All right, I have about 12:03, so we're going to go ahead and kick this thing off. We have 1 hour and not a moment more. So first of all, I want to say welcome to all of you. We're so happy that you've decided to join us today because it means that you are engaged on a critically important topic. How do we get health insurance for the early childhood workforce? So my name is Sharon Easterling, and I am working, recently retired, but still doing a little bit of writing and work for Opportunities Exchange. And thinking about the workforce has always been my passion, focus on compensation and benefits. I've always kind of worked on these issues throughout my career. And so I've continued to work on these at Opportunities Exchange to try to understand how we can get to where we need to be for our workforce. And as you probably know, I recently co-authored an issue brief with our co-presenter today. So I'm going to turn it over to Ashley Labetti and ask her to introduce herself to you also.
Hey y'all, my name is Ashley Labetti. I lead a early childhood strategy research practice called Pillars Research and Strategy. And we do so much of our work focused on workforce compensation, and in the past couple years, really focused on benefits. So health insurance in particular is something I am super excited to talk about, and probably nerd out about too much to people in my life, but I'm glad that y'all are here and ostensibly want to hear it.
Great. Thanks, Ashley. Okay, so a couple of housekeeping rules that we want to remind you about right at the top. If you'll keep your microphones muted, you can keep your cameras off. We have a lot of material to get through, and so we're gonna really cover a lot of ground, but we've also built into this session a lot of space at like a third, and a third. So we're devoting about a third of our time today for questions and answers because we know this is a really important topic. It's a really dense, complicated topic. We want to give you a chance to ask questions. We're going to ask that you put your questions in the chat box, and we will be monitoring them throughout. Those questions around logistics that Meredith can answer, she'll just respond to you right in the chat box. And then we'll be watching the questions and try to group them to make sure that we cover answers. We cover your questions as we go through. I do want to thank you and acknowledge that many of you put questions into the registration form. We asked what questions you had. We've actually already had some conversations with some of you about your individual questions and settings, and we will follow up with you if we don't answer your question today. We're happy to reach out or have you reach out to us afterwards. We really want to try to help you solve the problems that you're wrestling with around benefits and especially health insurance. So we'll have plenty of time for Q&A, questions in the chat box. And then the last thing we want to assure you of is that we're recording this session, and we will send everyone a copy of the slide deck and a link to the recording, which will be out on the OpX YouTube channel. So you'll be able to access that pretty easily. So let's get started. You know this information already, but we just thought it was important to remind us all that of all of the, professional sectors, the early childhood sector really suffers mightily from not having investments in salaries and benefits. But the percentage of folks who work in a childcare setting who have health insurance provided by their employer is about 20%, as opposed to a little over half for all other occupations. So we really struggle mightily with these issues, and that's kind of why we're working on it as we are. So in this session and for this brief, we made a couple of assumptions, and we want to put those out there at the beginning here. So we believe that health benefits are a critical part of a comprehensive compensation package. We can't just talk about salaries and hourly wages. We have to start really wrestling with how we move the needle on benefits. We believe that it should be the norm and not the exception for early childhood educators to receive health benefits through their employers. That's where we want to go. And we've got some interim steps that we think need to be taken to move us in that direction, but that's our ideal. And we think that a really powerful way to shift the paradigm so that it becomes an expectation that anyone who works in an early childhood setting will have health insurance. We can create a paradigm shift by leveraging the very generous resources in the Affordable Care Act. So those are the things we're going to talk about today. Here's our agenda. We're going to talk a little bit about the ACA and give you some background and sort of talk about the benefits and the challenges. And then we're going to focus on ways to leverage the Affordable Care Act. And then, as I said, we've got lots of time for questions and answers at the end. So what is the Affordable Care Act? As you probably know, it's a piece of legislation that passed during the Obama administration, and it was really designed to do a couple of things. It was designed to help people pay for health insurance if they didn't get health insurance through their employer, so financial supports. But it also does a little bit more than that. Actually, it does a lot more than that. If you can remember back a little more than 10 years, we had a real problem with health insurance, with things like dropping people when they reached maximums, and young adults staying on their parents' plan, and all of these sort of policy things around the insurance industry that really made it hard for people in some cases to get their medical bills paid and or to be able to have health insurance. So there were some reforms that were built into the ACA. There were financial supports, and then there was a way for people to shop for and understand how to buy health insurance, and we call that the marketplace. We're also going to talk today about the kind of lesser known piece of the ACA, which is a way for businesses to access tax incentives to provide health insurance, focused on small businesses. So we're going to focus on the individual marketplace and also talk about SHOP today. So why are we focusing on the Affordable Care Act? Why are we so laser focused on this? First of all, the ACA incentivizes good plans. So one of those reforms that I just talked about was health insurance plans have to have something called minimal essential coverage. And that means it has to pay for things like preventive care. It has to cover aspects. So people can't have an insurance plan, they can't buy an insurance plan and then be surprised that a particular thing isn't covered by insurance, right? That maybe they didn't know about. So the Affordable Care Act says that if you're going to get a plan, if you're going to buy a plan on the marketplace, it has to be good basic insurance, and it has to cover things that it has to cover these minimum essential things. The main reason that we focus on it is because the financial incentives are really, really a game changer, and we're going to talk about that. So, but there are challenges. If you're going to use the Affordable Care Act, if you're going to use the individual marketplace, there are challenges. First of all, it's an individual transaction, and so it leaves the employer out of the transaction, right? And so we need to figure out how we can work around that. The marketplace can be really difficult to navigate, even though it's supposed to be consumer friendly. Sometimes people really have challenges in understanding what they're buying and what they need to buy. And it really is designed for small businesses. So any business that has less than 50 employees, it's really focused on that. So I want to talk for a minute about strategies for providers to leverage the Affordable Care Act through the individual marketplace. If you are on this call today and you're running a childcare program and you're struggling to figure out how to provide health insurance, how would you go about leveraging? How would you go about using the Affordable Care Act? So we recommend these steps that are on this slide. That first of all, you need to survey your staff. You need to understand who already has health insurance, who needs it. And if they have it, where do they get their health insurance? So you need to understand the lay of the land. You also need to know what other benefits your staff really value. The second bullet here is one that we can't say enough. It's about engaging a broker. As we've said and will continue to say, health insurance is a very complicated industry, and we should tap experts to help us figure out how to create a benefits program that will best serve our program. Figure out your budget and then roll out a comprehensive benefits plan. So these are the steps for accessing it. And I put this slide in, it's in the issue brief, but I just think that people really need to understand how generous the benefits are. So if you look at the top table in this on this slide, what you'll see is that these are sort of the national average costs of health insurance. Without the tax credits, paying for family coverage, paying 75% of the premium for family coverage means the employer will spend $18,000 a year for those monthly premiums. And the employee will spend $6,000 a year. That really is unaffordable for folks that are earning the kind of wages in our field. But look down at the second table, because with the tax credits through the Affordable Care Act, now the employer, actually the employer won't be paying anything, and the employee, their bill goes down to $3,700 a year for family coverage. So the employer pays less, the employee pays less. But our recommendation is, what if as an employer, you took the benefits money that you would, instead of spending it on private insurance, you take that, and in this chart, we show $5,000 a year, right? You take that and invest it in your employees' benefits and look at what you can do. So this is an example of a provider who did exactly that. So the Otter Creek Child Center in Middlebury, Vermont, used to pay for private insurance. It was really expensive, and it was also hard for people to use because they had deductibles, and so it just wasn't a good experience for anyone. So the director moved the staff that needed insurance, helped them access Affordable Care Act plans on the individual marketplace, and then took the savings from that and created this really generous benefits package. They have retirement, they have paid planning time, they have dental, vision, telehealth. So you can see the strategy there is to take your benefits dollars and wrap it around supplementing health insurance. So staff are really supported, both for medical needs and for all of these other benefits that make such a difference in the quality of life. So again, this is just a reminder of our current environment, right? HR is complicated. Childcare programs are small businesses. They don't have the bandwidth to be able to become experts or hire HR experts to sort all of this out. And so, our recommendation again is a childcare director shouldn't have to become an HR expert. We're going to talk more about using a broker, but we can tap experts to help us. So if you're on the webinar today and you're involved with a network or a shared service alliance or some other intermediary in R&R, what are some things that you can do to leverage the ACA? First of all, we really encourage you to think about a marketing campaign. It's a little surprising how much people still don't know about the Affordable Care Act. There's a lot of people think it doesn't apply to them, or they're sort of skeptical about the level of financial assistance. And so we really need to take this message directly to the early childhood community. So who would you target for marketing? First of all, directors and owners of programs, right? We had a couple of questions that asked, how do you message the Affordable Care Act? What do you do about this if you're living in a state or in a context where it's not politically friendly to the idea of the Affordable Care Act, right? And so, one of our recommendations is do some marketing to individual providers. If there are folks if there are stakeholders in your state that really don't want to interact with the Affordable Care Act, take the message directly to providers because they are often struggling or without health insurance. And when people find out how much help is available, it makes a difference. And then target trusted messengers, right? Every business coach in the United States ought to understand this because what's more important to running your business than understanding how to access and how to leverage resources for your budget so that you can begin to build benefits in. So, trusted messengers. And then shared service alliances are beginning to do this. And we have some interesting models of ways in which people are creating back office services to offer HR benefits. And then the last thing I want to talk about is finding a benefits broker, right? Not all benefits brokers are the same. And I've actually talked to a couple of you who signed up for this webinar who use a broker, but the broker wasn't really interested or willing or able to interact with the Affordable Care Act marketplace to assist you with that. And so you can find, there are brokers who will sell you private plans, sell you supplemental insurance for other kinds of things, but will also work with your staff to access ACA plans. You want to make sure that any broker that you use can actually can help your staff, but can also help you with the administration of these benefits. So we have a really good document and questions to ask on how to select a broker. And there's a link in the PowerPoint. You can go and take a look at that. Actually, now I'm going to turn it over to Ashley and let her talk a little bit about the business option 2, which is a business accessing the ACA.
Perfect. Thank you. So Sharon spent the last little bit of time talking to you about options for leveraging the individual marketplace. There is a separate set of strategies focused on the Small Business Health Options program. So through or SHOP is also kind of how you might have heard it referred to, but through SHOP, so SHOP plans they're dedicated ACA plans. They're specifically for employers with fewer than 50 FTEs. In certain states like DC and Colorado, an employer can have up to 100 employees and still be eligible for SHOP plans. But similar to what we see on the individual marketplace, SHOP plans are really the same that you would find on the private market, with the exception that SHOP plans also have to meet the ACA quality standards that Sharon was talking about. Separately or different from the individual marketplace, employers can start coverage through SHOP at any time, so there are no enrollment period restrictions. And certain small employers are eligible for the small business healthcare tax credit. So it's a temporary tax credit. It covers up to 50% of premium costs for for employers that have fewer than 50 FTEs. In certain states, there are also other kind of premium assistance efforts or strategies. SHOP plans. SHOP plans can be purchased through the SHOP marketplace. I'm going to talk about that in just a second because it's kind of a complicating factor of SHOP. But through the SHOP marketplace, through a broker, or directly through an insurance carrier. So on the next slide, the um, I'm just naming here kind of how we're thinking about the why shop plans are appealing. And really, the primary advantage is for recruitment and retention. So using shop plans or purchasing shop plans, providers can directly offer health insurance to employees as part of a comprehensive benefits package. So for the, from the experience of the employee, it wouldn't necessarily look any different than if the employer purchased from a private insurer. And so that is definitely one of the kind of primary advantages. There are also, because an employer is offering health insurance, there are also more options for types of financial support. So you might have heard about health savings accounts or health reimbursements accounts. Those are kind of tax advantageous accounts that employers can offer if they directly offer health insurance that don't necessarily push their employees out of eligibility for the premium tax credits that aren't necessarily an option through individual marketplace. So we're addressing a lot of the issues that we've encountered, directly offering insurance from your provider, like a seamless process that looks very similar to other professions. So like this is great. And for certain providers, purchasing plans through shop is definitely going to be the best option over individual marketplace plans and the private market. That comes with a big but or a big caveat, which I start talking about on the next slide. So it actually might not even be a viable option. So you can kind of think about two very different experiences depending on who you are or where you are as a provider. So shop plans actually aren't available in all states. When, at the onset of ACA, there was a requirement that all states had to have some form of shop marketplace. There was a shift in 2019, and that is no longer required. And for states that have a federally facilitated or who participate or use the federally facilitated marketplace or healthcare.gov, they basically purged healthcare.gov no longer has a shop or a small business purchasing marketplace option. So that's a problem. Figuring out, in order to purchase a shop plan, you would have to, as I said kind of earlier, go through, in those states where there isn't a shop marketplace, go directly through a carrier or through a broker. But carriers aren't required to offer shop plans, so they might not exist, and it's complicated. Also, the small business healthcare tax credit isn't as generous or right now as permanent as the individual marketplace financial assistance that Sharon was talking about. So all of those things combined make it that shop is a very, very good opportunity for certain providers, and it might not be the best choice for other providers. And it's actually a really great jumping off point for states that are looking at their policy options, which I tried to segue into on the next slide.
So Ashley, there's a couple of questions. Just want to say that there's a couple of questions that have come up around shop. And so one of them, we should point out that you have the state listing in the appendix. One of them is what states, where is this an opportunity and where is it not? And the other part of that question is what can states do to boost shops? I think you're going to cover both of those, but we just want to assure you that we're looking at your questions, and if we don't address them when we're talking, we're going to do it at the end, right?
Yes.
So, okay.
So
Oh, I think Ashley just froze.
the question about where do shop marketplaces exist is
Alrighty. So, Ashley is freezing. You know, you never know if it's you or if it's the person who's talking. Ashley, I'm hoping you're going to jump back in when you can hear us. So like we said, we do have slides at the end that list the states that have shop marketplaces, and we'll cover that. I'm going to go ahead and answer a question while I'm waiting for Ashley to unfreeze, which was about the tax credit. So it looks like she got kicked off, and hopefully she's going to be able to sign back in momentarily. So about the tax credit. So the tax credit for the individual marketplace, it's a federal tax credit. So if you live in a state where, you know, this is not state income tax, right? This is a federal income tax credit, and it's a credit, not a deduction. And what that means is, you know, if you know anything about the earned income tax credit or the child tax credit, these are both examples of tax credits. It is money that comes to you. It doesn't have anything to do with how much you pay or owe in taxes. It's a payment that comes to you. And the really wonderful thing about the Affordable Care Act tax credit is you can take the credit in advance. So when you work with a navigator or a broker, they will help you on the marketplace to calculate how much of a tax credit you're eligible for. And what that does is it writes down the cost of the monthly premium. So if your health insurance plan costs $500 a month, and based on your income and your family size, you're eligible for a $400 tax credit. What that means is that you will only pay $100 a month, and the tax credit will kick in to pay for that. So it's called a premium tax credit, and you can take it in advance. So it's a really good deal. And Jackie, to answer your question, this won't affect your future Social Security earnings, because again, it's a credit, right? And so no danger of that. Ashley is back.
Yeah,
Take it away,
sorry
Ashley.
about
That's
that.
all right.
It's excellent timing for my Wi-Fi to do that. Did you get into healthcare for childcare? Is it helpful if I talk about it
Oh,
quickly, or
I
are you
didn't.
good to
No,
go?
I was answering a question about the tax
Okay,
credit.
great.
Yeah.
Okay, so on the slide previous, so I mentioned that SHOP is a potential jumping off point for state policy. So in the slide previous,
Let me go back.
yes, one please. So this is something actually that DC did. So I'm sure if you're interested in health insurance, it is very likely that you heard about the Pay Equity Fund. So in 2021, the District Council created the Early Childhood Educator Pay Equity Fund. The whole point of the Pay Equity Fund is to increase compensation for ECE staff in the district. One of those efforts, or one of the ways that the district is using Pay Equity Fund dollars is to fund healthcare for childcare premium assistance. So it is a premium assistance program that is dedicated specifically to offsetting the costs of premiums for early care and education staff. The way that it works, there are kind of two mechanisms. One is through the individual marketplace, so similar to the way that that the individual tax credit works. But the other way is through SHOP. So, structurally or from a process perspective, a employer or provider would go through the state-based or the small business health options marketplace in DC. They select a plan to offer their employees. The plan has to meet certain standards. So in its first year, it had to be a silver level plan. And at that point, the employer decides how much, if at all, they want to offset or contribute to the employee's health insurance premium. If the plan meets the minimum requirements, so a silver level plan, and the employer doesn't contribute anything, then the employee cost will be zero. If the employer selects a higher level plan, so as of 24, the new standard is gold. So if an employer picks a gold level plan, the employee cost will still be zero. But if an employer selects a higher level plan, they can offset the cost. So if you're looking at scenario A on the left, looks like kind of your traditional without HC4CC funding. That is, here's our estimated monthly premium for a reference plan. The employer cost is, we're assuming 50% of the reference plan. And then the employee cost is the remainder. On the right side with scenario B, that red line is the discount or the subsidy that would come through from the Healthcare for Childcare program. So there's really
I think we're going to struggle through the internet issues today. So I'm going to say a couple of things and try to keep us going. And hopefully Ashley will return. The thing that I want to make sure that you hear though is, and I think Ashley's going to talk about this a little more when she talks about what states can do. This was an initiative where the local, as in DC state government, put additional money into the benefits plan to be able to subsidize, to basically to enhance the SHOP program. So that is a strategy that states may want to consider. And I believe there are some other examples as we go through. So for states that want to really try to address this at the state level, this table sort of shows some options. So if you want to increase the uptake of the Affordable Care Act, obviously communication, marketing this, helping the field to understand that this is an important resource for people to take advantage of. There are ways for states to enhance their marketplace by adding state dollars on top of the federal tax credits. And in the third column here, you see, looks like Ashley is trying to dial back in. So hopefully she'll be here soon. And then the third strategy was the DC option, which is adding money to the existing resources through SHOP. So those are three ways for policymakers, for state leaders to really begin to leverage the ACA for the field. So these are some states that have added additional subsidies on top of the federal resources that are available. So you can see that the blue are the states that already have subsidies that they have added. There are three states, Connecticut, New York, and Pennsylvania, that are planning to expand subsidies in 2025. So I'm going to actually wait for a minute because this is Ashley's area of expertise, and I'm going to try. And I'm not going to try to explain these. I'm crossing my fingers that she's going to be back soon, and I'm going to look and see if we have other questions in the chat box. So there's a question about tax credits being temporary. So there are a number of tax credits. There's a small business tax credit, and then there's the SHOP marketplace. The small business tax credit for an employer who offers health insurance I believe that is time limited, and I know that in the first year it will reimburse up to 50% of the employer share of what they spent on benefits. So it is pretty generous. I think it's also true that that is a time limited benefit. And I
Yeah,
apologize.
it's listed. I'm gonna keep off video and hopefully that's gonna save something, but
Okay, great. Yeah, please
it's
take it away.
limited to 2 years.
2 years.
It is a temporary tax credit. So when we're looking at the generosity of tax credits at the federal level, the individual marketplace tax credits are again more generous.
Do you want me to go back, Ashley? I showed this slide. Where do you want to pick up?
No, this is good. I mean, this is fine. If you want to go, so these are state-funded subsidies not dedicated to early childhood workforce necessarily, although in Washington state, there had been one previously funded through ARPA dollars. On the next slide, I'm calling out just 3 specific states. So Colorado, Massachusetts, and Vermont. The whole point of these subsidies is to wrap around the federal premium tax credit. So part of this means that they are reducing the cost of premiums for people in these states. But the other part of it is, particularly in Colorado, making some form of health insurance financial support eligible or available to people who would in other circumstances not be eligible, such as undocumented Coloradans. The other thing that's really interesting here is that there are different ways that states are funding these strategies, including ones that have or built on federal funding. So Colorado is using an ACA state innovation waiver. We call those 1332 waivers. And they're somewhat complicated, and I can get into all the details offline if you're really interested or looking at kind of putting a finer point on the state policy plays that are available. Same thing with Vermont. They're using a different waiver, which is a 1115A Medicaid demonstration waiver. Both of those are basically those states came up with ideas for cost savings on both kind of the ACA and in Medicaid. And instead of federal funds being pulled back, they get to use them in different ways. And so those are the way that they designed them is, they're very different, but there are kind of really interesting options. So when I talk about state-funded subsidies, your brains don't necessarily need to go immediately to state general funds, although places obviously do use those. The other part, Massachusetts is also really interesting for 2 reasons. One, because it's up to 500% FPL, and because the federal funds or the way that they're thinking of funding the subsidies is in part through the employer medical assistance contributions, which are similar to or mirror the federal requirements under ACA. So basically, employers need to contribute to a fund in order to support the Commonwealth Care Trust Fund. I'm going real fast through these, but the other things I want to call out are local efforts. And so that local, we're including cities, counties, foundations. There are limited or relatively few mechanisms to build on ACA as a kind of at the more local level because of, it's a federal law administered by states. And so it's more complicated, but there are 2 big ways to do it. One is communications and information sharing. So Sharon talked about that a lot. The other one is through premium assistance wage supplements. I think I might freeze in a second. Okay, maybe not. On the next slide, there are two examples here. These are examples of foundation funded and locally county level led strategies for communications. One is through the Robert Wood Johnson Foundation. They funded grantees to do a whole bunch of enrollment and information sharing supports, one of which was, or the largest of which was grantee or sub-grants to 9 organizations that had strong links to specific underserved populations. So really targeted communication strategies. The other is in New Orleans and Kanawha, Charleston, and West Virginia. Those are local health departments that partnered with states to support outreach and enrollment. This is a key kind of lesson here is about, again, I think Sharon mentioned that there was a question about what to do if your state isn't supportive or there is a lack, the state sees it as not quite so palatable to lean on ACA. One of the things that they found, particularly in West Virginia, was about intentional language and the importance of partnering with community-based organizations. So it's still, those communities have very different perspectives on the ACA and still kind of found success with communication and outreach. Okay, and then the second to last thing I'll talk about is the wage supplement. So I wrote about this specifically in the paper, but Thrive Allen County is a cross issue organization in Kansas. They applied for grant funding to be able to offer ECE staff reimbursements for their health insurance premiums. They decided to apply for that grant because they had solicited feedback or engaged directly with providers to understand what the top issues were. They reimbursed staff for up to $300 a month to offset the cost of premiums, paid directly every 3 months. So it was kind of designed or intended to be also a recruitment strategy. They didn't have any parameters on where the insurance could come from, but the marketplace was one of the places that they looked into. The last 2 things that I think are really interesting here is that Thrive Allen County is a federally funded healthcare navigator, and they have certified community health workers. So the team, has the built-in expertise to help staff inform insurance decisions. The kind of negative side or potential negative of a premium assistance or a wage supplement program is that it has potential negative tax implications. So in some cases, the care coordinators, after working with people, found that the supplement actually it did more harm than good. It pushed them out of eligibility for the PTC and other benefits, so that they decided not to take it. That is actually going perfectly into my last slide, which is just a field-wide call for action. But the role that Thrive Allen County and other kind of enrollment support organizations play it's critical, right? So again, Sharon talked about this a bunch, so I won't spend too much time here, but we should not ask providers to become experts in health insurance. And every provider is going to have different strategies or a different approach based on kind of what their staffing needs are. The second is about effective communication. So again, talked a lot about enrollment supports and communicating the possibilities, but there's also an element here of reducing stigma. I have lots of very exciting data on the federal subsidies for every single, for all Americans across different professions, and how there are federal subsidies for health insurance across them, but those aren't as stigmatized. And even kind of in-house, we need to think about how we talk about ACA financial supports and how we can kind of reduce that stigma. And the last thing is continued advocacy. We talked about the advanced premium tax credit, how the particularly generous tax credit that is sunsetting, from financial relief and then through the Inflation Reduction Act is sunsetting in 2025. So there's a very important role for continued advocacy there. The other thing that needs to be said here is about Medicaid expansion. We've heard in a bunch of different places that when people go to sign up for health insurance through the ACA, they're not eligible for the premium tax credit, not because they make too much, but because they make too little. And so they're in a healthcare or a state that hasn't adopted Medicaid expansion. And so they're not eligible for anything through Medicaid, but they don't make they make too much to be eligible for Medicaid in those states, but they don't make enough to be eligible for the PTC, and that is a mess. The other appendix that we have here is the 10 states that have not adopted Medicaid expansion. So if you are from one of those states, please keep that in mind.
So real quick, Ashley, I'm going to put the slides up, the 2 appendix slides, so that people will know you're going to have this information in your hands because we're going to send you the slide deck. So this one talks about the different state situations, and this one talks about the Medicaid expansion states. So I'll just leave it on this slide for the moment. So this is our Q&A time, and we just have about 10 minutes left. I want to make sure we talk about this. Several people have asked ahead of time and on this call about any implications for home-based providers. Unless you're a home-based childcare provider who is earning way too much money to qualify for a federal tax credit, you should absolutely be accessing the insurance plans through the individual marketplace. I can't think of any reason why. And if you are a group home and you have 1 or more employees, you are still a small business. And so what we've said to centers is anyone who's working for you should be able, and you can help them access the individual marketplace. You know, again, you should be working with a broker. Even if you're a home-based provider, find a broker that will help you understand all of these options, and your employees can access marketplace plans. And then any money that you would be spending on insurance can be reinvested into things like vision and dental and retirement. So this should be a perfect solution for home-based providers. Oops, sorry. So other questions, put them in the chat box, or if people have a burning question that they really want to ask, and you can ask Meredith to come off of mute and ask your question. I'm actually scrolling through now and looking at.
Melissa, so Sharon included a really helpful appendix about things to think about for selecting the right broker. She also is generally an expert in this area. And
see if I can go back to that slide.
I'm sorry to speak for you, Sharon, but I'm also very sure she would want to talk to you, or like be very open to talking to you offline.
Yes, I would be happy to. Let me go back to that slide. So when you get this slide deck, there will be a link. But if you go to the OpEx website, I think some of you saw the advertisement for this webinar and didn't necessarily get to see the issue brief. So we issued a paper. It's 10 or 12 pages long with a lot of detail in it and a lot of links to these resources. So you can access that either through this link, which will take you to that issue brief. And there's a whole, one of the documents is how to select a broker. What questions should you ask, right? But there's a lot of information in the issue brief. So if you haven't had a chance to read that, you'd want to go take a look at that, and then definitely reach out to us with your questions. Let's see. What else do we have?
Mitchell, I can I answered it a little bit in chat, but state-based marketplaces aren't required in order to participate or receive the small business tax credit or purchase a SHOP plan. It comes down to the reaching out to the providers or the brokers. I would start with a broker nearby to determine if any carriers in the area offer SHOP plans. So in order to be eligible, the provider needs to purchase a SHOP plan, but the only way to purchase a SHOP plan is not through a SHOP marketplace.
So there's one other distinction I want to make sure that we call out today, because I know that there are a number of states, to their credit, they have paid special attention to making sure navigators work with individuals, making sure that navigators understand the childcare business constraints and are really sort of primed and ready to help individuals. There's one little tweak to that model that I want to suggest that intermediaries and state leaders might want to think about. And that is what we talked about sort of early in this session, which is reconnecting the employer and the individual and the marketplace, right? Like making that connection. That takes an extra effort because it's by definition, an individual marketplace. So it's absolutely true that we can tell employees, go on the marketplace and contact a navigator and go get yourself health insurance, right? But what we're suggesting is if the employer plays a participatory role in that, if the employer is working with a broker and the broker is able to counsel their staff members, their employees to access the marketplace plans, and then also work with the director to buy supplemental insurance, to purchase dental and vision and retirement and those other benefits. So it becomes part of a package. The key to this is having the resources from the marketplace really be built into the benefits package of the program. It's a little tricky, right? Because it's not designed to do that, but we just really believe that we can't afford to leave these resources on the table when we're thinking about the workforce challenges that we have. We've got to be able to both provide a level of basic insurance and then to provide these other benefits with the budgetary constraints that we're dealing with in our sector. So I hope that that little nuance makes sense. It's a sort of a different approach to using this. So it looks like if you join this webinar and you didn't pre-register, make sure you just put your email in the chat box and Meredith will scoop all of that up and make sure that you get a copy of the recording and the slide deck. Let's see. Any other questions? I see lots of friendly names in our participant list here. Well, we got through all the material, Ashley. What do you think?
That was a battle. Sorry, y'all.
It's a pretty dense topic, and you know what? Neither of us are insurance experts, but we know sometimes Louise Stoney will say, "I know enough to be dangerous," right? But hopefully we know enough to be helpful, and that is know the resources that are there, find experts who can help you access those resources in the right way for your program, right? I mean, the one consistent message is that every program, every provider is going to have their own individual circumstances and needs, and there are folks who can help you, and there are folks who are willing to help you. And so do a search for a broker. I don't think I said this yet, but if you're in that, so if you're a program looking for a broker, or you're an intermediary, you're a shared service alliance, and you're trying to help your members access a broker, you should get a list of people in your area, do some initial research about them, and then write up a set of questions and contact folks. See who wants to work with you and find out who can offer you the best set of services. They need to sell their services to you, and you need to be a savvy shopper. But finding a broker and really tapping this resource is a critical piece of solving our compensation challenges. So the last thing I see in the chat box is that Meredith put our email addresses in there. You may reach out to us for follow-up questions. And I want to thank everybody for coming, and I want to thank everybody for your engagement on this topic, because we have to stare this thing down. It's a really big problem. It's not just our sector. Health insurance is a really big challenge for all of us. And there are some solutions, there are some paths forward, and we need to make sure that we're availing ourselves of all of those resources. All right, thank you, everybody. We're going to end now, and you will hear from us very shortly with the follow-up materials. Thank you for coming, and we wish you the best as you try to work on this issue.